Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Dr. Varbaro, Chief Medical Officer, the Chief Medical Officer at Bergen Newbridge Medical Center, and Assistant Professor of Medicine at Rutgers, New Jersey Medical School, and the Chief Medical Advisor to Bergen County, New Jersey. The highly contagious Omicron variant is spreading at a rapid pace across the world. We are all wondering, what symptoms should we be looking for? Should the kids be back in school? Do I bother with boosting? Happy New Year, Dr. Barbaro. And what a beginning of the new year it's been.
Yeah, right. Hey, and Happy New Year to you and to everybody who's watching. It's been quite a start to the year, but I actually think, and we'll probably touch on this as we get going. I actually think that this year portends a much better year for a variety of reasons, which I'm sure will come up as we're talking.
Of course.
But yeah, so in terms of Omicron, I'm sure people have seen the news in that the symptoms for this, it's still actually, even though you hear about that there's different symptoms, it's still mostly the traditional COVID symptoms. It's still fever, sore throat, loss of taste or smell. Omicron does have less of the loss of taste or smell and can have more like nasal stuffiness and more sneezing and that kind of stuff, more mild symptoms. But still headaches, body aches, that's really more what you see with it. So again, any symptoms could potentially be symptoms, but with Omicron, you can have asymptomatic patients. You can have people who it does look like a cold. It doesn't always look like a cold, which again I'm sure we'll talk about. But it's worth it to be just aware.
So the buzz is it's nothing more than a cold. What are you worried about? Why are we making such a big deal? Why, what's the shortage, happening all over the place with employees? So, what's the truth?
Yeah, and then you hear people who are like, the sky is falling, we need to shut everything down, which is the other end of the spectrum, and neither is really correct, right? Like with most things, the truth's somewhere in the middle. The reality is that for a large portion of people, it does have more mild symptoms, which is a good thing. That doesn't mean that it's mild symptoms for everybody. If you are vaccinated under age 75 and not immune compromised, you have a good chance of having mild symptoms. But again, we still see people even in that category who do have stronger symptoms and do need to be hospitalized. To give you a rough idea, when we first started with COVID 2 years ago, the original variant was about 25 times more deadly than a flu season would be. Through the various mutations, Delta was around the same, but Omicron were probably in the 15 to 18 times more deadly range. So that's significantly less, but it's still not the flu and still not a cold. Again, if you're vaccinated and so forth, then that deadliness range drops again significantly. And with some of the newer medications, which again, I'm sure we'll talk about, it can drop even further. So we're actually getting to a pretty good spot, but so we're in the middle, right? So it's not as scary. It's not as like everything needs to be shut down again, scary like it was 2 years ago. We're not at that point. Like with most things, it's a balance between risks and benefits. That's kind of what medicine is. I know people don't like to hear that, but it's kind of true. Like as physicians, that's the decisions we make. We look at the risks and benefits. The easiest example for this is chemotherapy. Chemotherapy has really bad side effects. It can be harmful to some people, but most people it helps. On average, it's beneficial. And it's kind of a similar thing here of the balance between what we should be doing and what we're not doing. It's not as scary as 2 years ago. I think it's safe to have schools open. I do agree with keeping them open. I do think it's safe to do certain things, but I do think you need to be careful. I do think you should probably mask if you're in closed places with a lot of people. You should, again, make sure that you're vaccinated and boosted. And again, I'm sure we'll talk about it more, but we can go from there.
So what's the story with boosters?
Yes.
should everyone get them? I mean, they're talking about a fourth dose. As a matter of fact, my cousins in Italy were just mentioning to me that they're going for their fourth dose.
Mhm.
Is this where, is this paving the way for our future? Something that we're going to have to do for a long term, just boosting every few months?
It's really hard to say that right now. It's very interesting. Israel, who's been ahead of us on a lot of stuff, is gone full ahead with fourth doses, with fourth boosters. Here's what we know. We know that, actually, let me take a step back. We know that with each dose of a vaccine, your immunity gets better. Now, I wish I could remember who used it. I heard this used the other day, and I'd give credit if I could remember where I heard it, but I'm going to steal it because it's a good analogy. The best way to think about your immunity to this disease is almost like a medieval castle defense system, in that there was like a wall with a moat, and then behind the wall with the moat, there'd be knights to fight, right? And the wall with the moat is basically like the antibodies, and that prevents you from being infected. The knights are what we call T-cell immunity, and that's what prevents you from getting really sick. Now, every time you get a shot, it not only builds up more of the wall as the wall and moat crumble a little bit, because that crumbles over time, but it also makes your wall stronger, and it makes your knights stronger. It's actually an interesting phenomenon. The antibodies you have become higher quality with each dose. So what we're seeing right now is that it's holding up pretty well with third shots here in the US. Might that change? Sure. And yeah, they are having that in other countries who've gotten hit before us. So it's quite possible. I can't really say, what it's going to be. I also think it might depend on the person. It's very interesting. Just anecdotally speaking, like we see very different responses when people decide to come in and get tested for their antibodies developed from the vaccine or to having had COVID. We see very different responses in different people, so I wonder if that's part of it. So I know it's a fuzzy answer, but the truth is that right now we know that with Omicron, you should be vaccinated and boosted. Those are the people who do the best. With the longer term, it's hard to say.
Makes sense. It makes
Yeah.
sense. So I remember, earlier in our talks, we talked about monoclonal antibodies.
Mhm.
I heard they no longer work. What is with that?
Sure. So again, just so people understand it, if they didn't see our earlier talks, monoclonal antibody is a lab-created antibody against COVID. And they developed, and there's a few different companies who developed them. There's currently 4 that have been on the market. The initial 2, one was called bamlanivimab, and the other was called Regeneron, are not as effective against Omicron. They don't have zero effectiveness, but it's very limited and probably not worth using for Omicron. However, there are 2 others, one of which is specifically made for people who've had who have severe immune compromise, and so that's really mostly only available, at least in New Jersey, at the major transplant centers.
Mhm.
But the other one is called sotrovimab, and that works just like the other ones, and that we do have. Now so that is effective. The issue is that because there was so much of the other 2, there wasn't as much stores of sotrovimab, so it's a little bit in short supply. They're obviously ramping up production and getting it to us. I'm sure that within the next month or 2, we'll probably have a good amount of it, but for right now, it's still a limited supply. So the monoclonals work really well for pretty much anybody who has COVID, but it does not basically need to be hospitalized. It doesn't have like a drop in their oxygenation and so forth. It also is actually quite beneficial if you live with somebody who's COVID positive and you have a risk factor of more severe COVID. Right now, pretty much everybody's stopped on giving it that widely, and they've put a little more criteria on it just to try to get it into the patients who would most benefit from it, the patients who are most at risk. But that doesn't mean that you have to be super high at risk to get it. We actually give it for a pretty broad range of patients here at Bergen Newbridge. And I know all the other area hospitals have it, and they have their criteria as well. So for us, at least, the way that we do it is people call up, they schedule an appointment with one of our telemedicine providers, and they interview them, and they determine if they would be one of the patients who would most benefit from it, and then they arrange them to come in and get infused.
So what are some of the criteria? Can you elaborate a little bit on that?
Sure. I mean, the biggest one is age. If
Okay.
you're over age 65 is actually what most places use. 75 definitely should get it. Also, people who are immune compromised. So again, we said organ transplants, but even who have diseases that cause immune compromise or on other medications like Humira or high dose steroids or things like that would cause immune compromise. That's a high one. And then there's a host of other medical illnesses. Probably the most important one is diabetes, all the way down to certain types of heart diseases and lung diseases, but not all of them. Certain types of kidney diseases, that kind of stuff. So it's a broad range of different criteria that we have. Like I said, anybody, regardless of their other medical illnesses above age 65, should definitely is definitely criteria. So I see somebody wrote, "Isn't sotrovimab the proper monoclonal for Omicron?" Yeah, that's what I was saying before. It's the one that works the best against it. So
Okay. So the news had stories also of a pill for COVID.
yes.
What is that?
Okay, so there's two of them on the market. Probably the most promising one is made by Pfizer. It's called Paxlovid. It's a really powerful pill. If you read the studies on it, it seems, again, with anything that's new, you never know 100%, but it seems very, very safe from the trials that they've done, and has a very high efficiency against the virus. Reduces the risk of hospitalization and of mortality by like 90%. So very, very powerful medication. The issue is, again, it's new. So it's not like they had it sitting around waiting. So it's still in short supply. So again, most people are using a criteria on who to do it. We actually don't have it at the hospitals, at least in New Jersey. They distribute it to the pharmacies. So there's, and not even all of them. So you kind of have to, your doctor can write you a prescription for it, but you need to find one of the pharmacies who actually has it in stock. There's a second one made by Merck. It's called Molnupiravir. It's not as effective as the Paxlovid. It also has more side effects described in the literature. So obviously the Paxlovid would be your first choice. And the Molnupiravir is also a little bit limited in supply as well. But I think in the coming months you're going to see that become very widely available. And once that happens and it becomes something that can be prescribed for most people who have it, I don't know if you've ever had flu and been prescribed Tamiflu. I mean, this isn't Tamiflu. It works in a different way. And right now, again, it's not being used like Tamiflu where you give it to anybody, but that could very well be what happens. Something that gets prescribed to people who have COVID and drastically improves it. Again, even with that, remember before I said the Omicron, what the mortality rates look like. So that would drop it down significantly, but you'd still be in the 2 to 3 times more deadly than flu range. So it's not like over, but we're getting pretty close.
Mm-hmm. So I just to in layman terms, because I'm curious.
Sure.
And I don't watch the news that much. I'd rather get it from
I don't
the
blame
source,
you.
Dr. Varbaro. So, can you take this COVID pill if you've been vaccinated and boosted already? And I'm assuming you have to be COVID positive in order to take it, not just an exposure.
Correct. Yeah. So
Okay.
it would be. It's basically if it's in the first 5 days that you've turned positive or started having symptoms. So you'd have to be COVID positive. But yes, theoretically, you could take it if you had COVID and if you've been vaccinated or so forth. The same thing's true with the monoclonals. We give them to vaccinated patients. The biggest risk factor is age, regardless of other stuff. The biggest risk factor is age. So the older you are, the more at risk you are.
So I'm going to go back to the monoclonal.
Sure.
I remember vaguely someone mentioning on the news that, you couldn't be within a certain window of time of your vaccination if you become COVID positive after. Is that correct?
So what you mean for monoclonals or?
Yes, for monoclonal. Yes.
So it's the reverse. It's
Okay.
if you receive monoclonal, you can't go and get a shot of a vaccine for 90 days. And if you stop and think about it, it makes a lot of sense. What the monoclonal is it's an antibody that's made outside of your body that fights against COVID. The entire purpose of a vaccine is to show your body what COVID looks like. So it creates an immune response. If you've got an outside immune response in you, you're not going to react to it. So it's not that like you'd get sick or cause a problem. It's just the vaccine wouldn't work. So if you got a vaccine shot within 90 days of getting monoclonal, it's not going to do anything. So it's kind of like, why bother, so.
Got it. That makes total sense.
Yeah.
So, what's the role of testing now? I keep hearing about people not being able to get a test or it's taking too long. I mean, what's the reason for that?
So it's a lot of different issues. At the beginning of the pandemic, I'm sure everybody remembers we didn't have tests here in the U.S. Over time, they built it up, but as the vaccines became more prevalent, people stopped testing as much. So, we live in a capitalist country. The companies stopped making as many of them, so they didn't have them. So they weren't ready, to have them to go. And so, there's a shortage of them. In addition to that, we're kind of working under almost the old rules of the old variants, which is creating, I think, some disconnect on what people are requiring for stuff. I'll explain what I mean. Like at the beginning of this, like one of the best ways to measure things was in the number of cases. But with Omicron, there's a lot of cases, but really what's probably more important is hospitalizations or ICU beds, as an indicator of how severe the pandemic is. Similarly, at the beginning, everybody was requiring you to stay out of work 10 days. And that was a lot of news the last week or so of the CDC changing the guidelines. We could talk about it a little more if you want. But the other piece to it is a lot of places require people to get a PCR test to return to work or to return to school or to do that. And in reality, a PCR test, you probably don't need at this current point. In reality, from a medical standpoint, an antigen test or a rapid test is actually just as good. I won't go into the math of it because it bores everybody, but it bores most doctors hate that class in medical school. But not, I was a math major, so it didn't bother me. But as the prevalence of an illness goes up, the less specific tests actually become better. They become closer to the other one. So right now with Omicron so prevalent, an antigen or rapid test is almost as good as a PCR. And especially if you have more of them, you can just do more of them. You can definitely make up for that and get the results faster. The problem is there weren't a lot of those so we have a combination of things. We have an explosion of the number of cases. We have a demand for a particular type of test. We have a low number of tests out there for people to get, and it's just creating a crunch everywhere. And it's just backed everything up all over the place. So and then you have also staffing shortages all over the place too. Pretty much every company with people out with COVID on quarantine. One, there's not a ton of tests available right now. And two, the turnaround time's a little long. That being said, testing is still one of our most effective ways to prevent the spread. If you really break it down, right now we have 4 proven ways that help cut down the spread of COVID, and they're at different levels. The strongest one still is the vaccine. 2 and 3 are kind of tied. Almost. It's hard to say. I couldn't tell you which one is better or worse. One of them is frequent testing. Because again, in an ideal world, right, everybody just have a home test. You could test yourself. If you're positive, you stay home for 5 days. Your test goes negative. You have no symptoms. You're done, right? And you'd be all set to go. Mm-hmm. We don't have prevalent testing, but if you have stuff, you should use it. On the other, so that's a very powerful one. And the other one being ventilation, right? It's why you don't really need to wear a mask outside, especially if there's a lot of space or if there's good ventilation. There's certain countries that don't have high vaccination rates but have low COVID rates, and they're generally countries where everything's open air. So it's a very interesting thing to see. The fourth one being masking, which is not as powerful of a block as the others. It definitely has some effect, but it's not as strong as the other ones are. But to get back onto the testing, if you're able to get a test and you can get it quickly turned around, it's still a very useful thing to do. If you are having symptoms of COVID and you can't get a test, just isolate yourself, don't spread it around to people, be considerate of other people. But in reality, frequent testing is very useful and a powerful tool.
I'm going to go back a little bit about masking. So, there's been talk about get rid of those cloth masks, KF94s, actually.
KN95s, yeah.
Yeah, KN95s, and then there's the new one, KF94.
Mhm.
I mean, so which one's the right mask? I
So,
mean, is
so
there a right mask?
yeah, no. Here's what it comes down to, and I think that again, I think there's been really kind of shoddy messaging on masking the whole time. So just to kind of explain it, the traditional, I have one in my pocket yet, the traditional surgical mask, whether it's a cloth mask or one of these, actually it protects you a little bit, but actually what you're doing more with this is you're protecting people around you. This actually is very good at preventing stuff from coming out of you into somebody, and it blocks a little bit stuff coming back into you, but not as much. And it makes sense because these were designed for surgery, and the idea was so that the surgeons wouldn't infect the patients they were cutting open and doing stuff on, right? So it blocks very well. It's what we call source control versus respiratory control. So the cloth masks, most of them are kind of like this. There are some now that have filters in them. So once you start adding infiltration, now you're talking about more protective. So it's all in different levels. So an N95 or a KN95, which I do have one of those sitting right here, those protect you more too. So they create more blockage. So there's a lot of push that with Omicron is prevalent, especially if you're a high risk person, if you're older, if you're on immune suppressant medication. It probably makes sense, especially if you're going to be in a crowded area without good ventilation. Remember ventilation, that you should probably be wearing an N95 or KN95 or one of the other ones, or a cloth mask with a filtration system, or just something stronger. In terms of what other people decide to do, it's hard to say. There's not a set right one. It's a matter of different levels of it. If you can use the stronger protection, doesn't hurt, but that's ultimately up to the person. I've taken to wearing the KN95s when I'm around stuff because I actually find them pretty comfortable and they're pretty protective. But everybody's different.
This is true, and it
Yeah.
should be a comfort level. What you're comfortable with, masking, having
Well,
some
how
kind of.
you're going to tolerate it too, right?
Yeah, exactly. And bottom line is masking is proven that it works when you wear it. So
Exactly. So telling people they should wear a mask that they can't wear doesn't make a ton of sense.
exactly. Exactly.
It's just
So,
practical.
so is there an end to this in sight? I mean, they just talked about another variant that they possibly think they found in, I believe, France, was it?
Yeah.
So, I mean, is there going to be a rest to this?
Yes, there is. And
Okay.
so I don't know if you remember this, but this is now the third one of these that we've done together. If you go back to the very first one, I went into this very long explanation of the history of pandemics worldwide, but I'll do the Reader's Digest version of that, which is there's been a pandemic in human history about every 100 years. And if you look at the history of them, they all ended, every single one of them ended the exact same way. But they all did end. And the way that they ended was that eventually the infectious agent mutates or creates a variant that is, or a series of them that's more infectious but less deadly. And eventually it becomes something that is so much less deadly that it's just something you live with and you're not concerned about. So, for instance, the last big pandemic, the 1918 flu pandemic, that flu strain is still part of the seasonal flu we see every year. But back then they socially distanced and did all of these different things. And you don't worry about it as much anymore. Bubonic plague still exists. It's not the Black Death anymore. Syphilis was a pandemic in the 1500s, but it's not as deadly. And if you think about it, it kind of makes sense because it's in the infectious agent's best interest to not make you sick. The ideal situation for a virus is if it infects you and you never know it's there, and it makes tons of itself and it reproduces a ton and moves on. That's the best, right? If you get sick, you don't go around other people, you don't spread it, even if you're not socially distancing or doing all these other things, and especially if you're wearing masks and taking medications and doing all these other things, the virus dies. So it's just evolution that it eventually there's just this pressure on it to change. Now, here's the I'm going to tell you the bad news, but hold on because I'll give you some good news after that. And I said this back in the original one a year ago. All of those other pandemics lasted 7 to 14 years, with the average being 10 years. And I'm sure there are a bunch of people who just gasped watching this and said, "You mean that this could go on for another 12 years?" No. And the reason is quite simple. It's that we have a tool that they didn't have back then to force the evolution of this thing faster, and that's the vaccinations. And so another reason for getting vaccinated is not just to protect yourself. It's not just to protect those around you. It's also because it gets things back to normal more quickly. It forces this thing to become less deadly. And, even if you're young and healthy and so forth, you probably know some people who are on an immune suppressant drug, or older, or diabetic, or whatever. And so what you're really doing is helping them as well. Just based on what the numbers look like for Omicron, we're probably, especially once we have well-available Paxlovid, we're not quite at that point yet. There might be, and I don't want to scare people, there might be another variant or two after that. But I think at that point, I would not be shocked if we get through this year and this becomes something that's not so concerning anymore. Of course, I don't have a crystal ball. I could be wrong about that. But I think we're rapidly getting to the end of it, which is, I know that the last 2 years have been a slog. Trust me, it's probably not been a slog for anybody more than it's been for me. I'm a frontline medical provider, and I run a big hospital system and a public health system. So it's been a long 2 years. But if you actually take a step back and think that we could be through this thing in less than 3 years, it's pretty remarkable. It's also pretty remarkable, we talked about all these different drugs. We talked about vaccines. We talked about monoclonal antibodies. We talked about Paxlovid and Molnupiravir. I always say it wrong. There's also remdesivir and steroids. The fact that we have so many medications in less than 2 years of this thing existing, when they had to basically invent new medications, is pretty remarkable. It's actually a testament to human ingenuity that we've gotten to this point. So in the grand scheme of it seems like a slog. We're actually getting closer to the end. And so that's the hopeful thing. Like, the next month's going to be a little crazy, for this wave, but it will die down, and, we'll get through it. And I think we're getting close. We're getting close. I go into this year much more hopeful than I've been in 2 years. I'll say it that way.
Well, that's good to hear. And
Yeah.
I really do appreciate you taking the time to kind of clear the air on some of these ideas that were floating around. And I know myself, I feel a little bit better about what's ahead of us and in the new year. So I wish you all a very happy new year. Happy New Year, Dr. Varbaro. And as always, if you would like more information, please visit our website at newbridgehealth.org. And if you'd like to support the foundation, you can also find some more information on that website. And thank you so much, and Happy New Year.
Happy New Year to you too. And for everybody watching, get vaccinated, get boosted. Have a good one.